The World Health Organization has praised this country's management of the COVID-19 pandemic. The comments from WHO's Director General, Dr. Tedros Ghebreyesus, come after Prime Minister Dr. Rowley joined a media conference held by the organization on Thursday. The WHO Director General noted that Trinidad and Tobago started its vaccination program on Wednesday, but even prior to that, managed the pandemic successfully with simple solutions.
Trinidad and Tobago, your country, has done very well in this pandemic, and this is because of your leadership. Even without vaccines, using simple public health solutions, we can see from your own experience that this virus can be controlled. So thank you so much for your leadership.
During his presentation, Prime Minister Dr. Rowley urged the world to practice vaccine equity and pointed out that due to the rush for vaccines internationally, small island states such as the Caribbean are vulnerable, especially since price gouging and hoarding are taking place. He said equitable vaccine distribution is critical to controlling the virus worldwide.
We anxiously anticipate the promised relief and general benefits that a successful early vaccination program can bring to each of us. All we ask as members of the family of nations is that we not be forgotten, ignored, or worse, taken advantage of in this business of life and death.
WHO's Director General also agreed with Dr. Rowley in relation to the model of sharing and caring and believes this invisible virus cannot be defeated without solidarity. Finance Minister Colm Imbert has confirmed that government received a proposal for vaccines which would have cost government $1 billion TT. Speaking at the post-cabinet media conference on Thursday, Minister Imbert said he had a conversation with Health Minister Tedros about this offer, but does not believe it would be considered.
In fact, coincidentally, just had a conversation with the Minister of Health last night. There are offers on the table. The particular offer that he had been offered, when we worked it out, it would cost $1 billion. I'm serious, $1 billion. So that was known.
Minister Imbert said government continues to receive offers for the vaccine and will evaluate each proposal.
I know that the minister is receiving proposals from various sources, directly from the drug companies, from the COVAX facility, from sovereign governments and so on. So I expect within the next couple of weeks there would be more options on the table and the costs will become known.
Prime Minister Dr. Rowley has referred to a call by opposition leader calling for the resignation of the health minister as pure mischief. The Prime Minister's response comes on the heels of a statement from Health Minister T&T'S about the donation of COVID-19 vaccines from Barbados. On Wednesday, Minister T&T'S apologized for saying the vaccines were not a gift from Barbados and explained that he was initially misinformed. Via a release from the Office of the Prime Minister, Dr. Rowley described the behavior of the opposition leader as deranged and struggling for relevance. The Prime Minister explained the vaccines are for the protection of our population, and he accepted the offer from Barbados, knowing that not all suppliers of these products from India had received WHO clearance. He said the people of Trinidad and Tobago can continue to rest assured that their interests are well served in the management of this pandemic. The Ministry of Health has recorded 3 new cases of COVID-19 in Trinidad and Tobago. The ministry says the number of cases reported reflects the samples taken during the period February 15th to February 17th and not the last 24 hours. The total number of active positive cases is 154.